My name is Nancy Holekamp. I am a retina specialist in St. Louis, Missouri, and I specialize in diabetic retinopathy, age-related macular degeneration, things like retinal tear and retinal detachment. But I do have a particular interest in age-related macular degeneration. So a very advanced form of age-related macular degeneration is called geographic atrophy. So many people might be familiar with an advanced form called wet macular degeneration, for which we currently have a very effective treatment. But this is the other advanced form, and it's called geographic atrophy. It's an advanced dry form of macular degeneration. And atrophy means the cells are dying and no longer functioning. And they're dying right in the center of the macula, right where the center of vision is. So this type of disease, this type of cell loss or atrophy is very impactful to people's vision and their quality of life. Well, it was such an important study because, the spotlight has not really been on geographic atrophy. It's always been on the impact of wet macular degeneration. So this was a very powerful first look at the impact that geographic atrophy, or GA, has on patients' lives. And so they looked at over 200 patients in 9 countries. The 9 countries were like the United States, Canada, Australia, but also countries in Europe. Italy, France, Sweden. And they identified patients who were suffering from geographic atrophy, who had received that diagnosis from their doctors and were currently living with the disease. And what we learned is that there's a huge impact on quality of life. In fact, for these patients, vision is progressively, relentlessly slipping away. About 7 out of 10 patients said that the impact of this disease on their quality of life was much worse than they expected. And 2 out of 3 patients actually relied on a caregiver to accomplish the daily tasks of life. And, the majority of patients felt that it really impacted their ability to read or drive and do all the things that we associate with a high quality of life. Currently, there's no treatment for geographic atrophy, and that's one of the problems why it hasn't really received a lot of awareness or education to this disease is currently we don't have a treatment for it. So as a retina specialist, I am able to make the diagnosis. I can tell people what their prognosis is, and currently the news is not good. But when it comes to treatment, we don't currently have a treatment, and we're very much looking forward to uh, uh, developments, pipeline products that may, even by the end of the year, offer a treatment for these patients. Well, the study was sponsored by Apellis, and Apellis does have one of the pipeline products. And it would consist of injections into the eye that would slow the progression of disease. And right now, the disease, as many of these patients know, progresses relentlessly. And in most cases, patients will lose about a line of vision on the eye chart a year. So that's 2 lines of vision over 2 years, 3 lines of vision over 3 years. So it just shows you what the impact is. And so we're very much looking forward to anything that might retard or slow the growth of the GA lesions for people with this disease. Well, the key takeaway is awareness about this advanced form of dry macular degeneration called GA. The second takeaway is just to really understand the profound impact it has on older Americans who are afflicted with advanced dry macular degeneration, this disease we call GA. And the third is really to understand the emotional support that patients need, because it impacts their daily activities of life so profoundly. And many are relying on caregiver support.